Ear pinning is a very common procedure. This is often referred to as prominent ears. It's often referred to as bat ears. It's often referred to as congenital prominent ears that people develop throughout their younger age as a child. Often this is a developmental problem, and often it's very much related to genetics, and often the parents have had prominent ears in the past that they may have corrected or not, and it's passed on to their children. Majority of these procedures are performed in children because they get to an age where they can get teased at school for having very prominent ears, and people often call patients names like a teapot or bat ears, which can often be a stigma and cause low self-esteem to the patient. And often in childhood, these areas are addressed. We look to see where the problem is within the ear that makes it look prominent. So on the whole, there are three particular areas that we look for. We look to see whether the ears are protruding forward. We look to see whether the cartilage is lacking the definition of the fold and often has lost this area and the ears stick forward. And also we look to see the shape of the earlobe to see whether it's bent forwards or it's enlarged. That may need to be corrected at the same time. Now, in some cases, people haven't had this procedure for one reason or another, and more this is becoming limited in the NHS, so it's not offered anymore unless there's a good reason to have it done. So people are seeking to have this done privately, either as a child or as an adult. It's a very simple local anesthetic procedure done in adults. We numb the area for around the ear, and essentially we make a cut behind the sulcus of the ear, so the scar is hidden where the back of the ear attaches to the scalp, and through that cut we can then mold the cartilage back to where it used to be and secure it with sutures. And it's a very simple walk-in, walk-out procedure that often takes about 45 minutes, an hour to correct.